Cellulaze Cellulite Laser Workstation is the world's first cellulite treatment to address the very structure of cellulite. The following procedure will demonstrate how Cellulaze gently but effectively modifies the very foundation of cellulite in a single treatment, with clinically significant visible improvements in the appearance of cellulite that can last 12 months or more. Prior to treatment, a thorough patient screening should be performed to determine if the patient is best suited to the Cellulaze procedure. Photographs should be taken before treatment and throughout the course of recovery to monitor patient response to the procedure. Be sure to keep the camera and lighting settings and photo composition consistent to best discern treatment results. The Cellulaze treatment uses a very targeted approach to treating cellulite. Therefore, patient marking is a critical step in the Cellulaze treatment. Take time to mark the patient properly before treatment begins to ensure a suitable treatment. With the patient in the standing position, run your hand over the thigh area to determine the contour of the area. Then outline the perimeter of the entire area to be treated with the Cellulaze marking template. First, mark the large indentations that are approximately 3 centimeters or larger on the skin. Mark each indentation in the treatment area with a red surgical marker. Mark the elevated or bulging pockets of fat which measure about 3 by 3 centimeters square or larger with a green marker. After all indentations and bulging pockets of fat are marked, fill in the treatment area in 5 by 5 centimeter square grids. Number the squares to assist in documentation of laser treatment settings and endpoints during the procedure. Next, plan where to place your incision sites and place a mark for each site. 1 or 2 incisions are typically needed depending on the total size of each treatment area. The incision sites should allow you to easily access each square of the treatment area. Before beginning the procedure, ensure that you have all the proper materials, including all sterilized laser accessories. If necessary, a sedative may be given to the patient either orally or by IM injection. Once the patient has been positioned properly and draped, apply a small amount of local anesthesia to the incision site. Next, use a no-core needle, trocar, or blade to create a small incision at the treatment area. Introduce the tumescent anesthesia through the incision site to numb the entire treatment area. Inject per each 5 by 5 centimeter square. Do not exceed 80 cc's per each square. Any excessive tumescence will require additional laser energy. Excessive laser energy could lead to adverse events. Following tumescence of the treatment area, the laser cannula can be introduced through the same incision sites. Tumescence mixture may include 50 cc's of 1% lidocaine without vasoconstrictor and 1 milligram of epinephrine per liter of warm saline normal solution with 12 cc's of 8.4% sodium bicarbonate. Alternate tumescence formulas may be used. The Cellulaze laser treatment is a 3-step process. Cynosure's SideLight technology is used to target and treat the 3 different structural problems associated with the dimpled appearance of cellulite. The Cellulaze laser uses an Nd:YAG 1440 nanometer laser equipped with ThermaGuide thermal sensing technology in all 3 steps of the process. ThermaGuide measures bulk average temperature to provide a more uniform treatment and prevent excess thermal damage of the treatment area. Prior to firing the laser, be sure that the patient and all personnel in the room are wearing appropriate protective eyewear. Set the treatment parameters using the touchpad on the Cellulaze laser system. Set the wavelength to 1440 nanometers. Set power to 8.8 or 10 watts with a frequency of 25 Hz. If the SmartSense accelerometer is used, frequency will be automatically selected. The Thermoguide treatment temperature should be set between 45 to 47 degrees Celsius. Subdivide the treatment area by selecting 3 to 6 squares to treat at one time. Perform all 3 laser steps in the selected block of squares and repeat all 3 steps for every block of squares throughout the treatment area. This patient will be treated in blocks of 4 squares. In the first step of the Cellulaze procedure, the pockets of bulging fat are treated. Only areas identified with bulging fat should be treated with the laser accordingly. For example, if there are no squares marked with bulging fat, no laser energy should be applied to that square at this step. Introduce the laser fiber assembly through the working incision and into the first 5 by 5 centimeter square containing pockets of fat. Use approximately 300 to 600 joules of laser energy per dimpled area depending on the size of the area. In the third step of the laser procedure, direct the side light fiber toward the surface of the skin to promote collagen production through tissue coagulation to increase skin thickness and elasticity and to smooth out the dermal fat junction. The entire treatment area should be treated evenly and uniformly at this step of the treatment. Position the cannula about 3 to 5 millimeters deep below the skin surface and begin lasing. Reciprocate the cannula in a fan-like motion throughout the 4-square treatment area. Use Thermoguide thermal sensing cannula to uniformly distribute laser energy in each treatment block. Continue to move the cannula throughout the area. If the Thermoguide alarm sounds, move the cannula to an adjacent square within the defined treatment block. Once the whole block is treated, a second pass can be made in the same fashion until the total amount of recommended joules is depleted or there is no resistance felt throughout the treatment area. It is important to note that if you treat an area larger than 6 squares at once, the heat from the laser energy will dissipate during the treatment and a uniform energy delivery will not be achieved. This may negatively affect your treatment outcomes. Total laser energy delivered to each 5 by 5 centimeter treatment square should not exceed 1,000 joules per square. Joules delivered per 5 by 5 centimeter square should be used as your final endpoint. Monitoring the total number of joules delivered to the treatment area is critical for a safer and more effective outcome. Do not pull the cannula all the way back to the incision site with each stroke. Work in short cannula movements within a block of 4 5 by 5 centimeter squares. This prevents heat buildup at the incision site. In addition, working in a small area allows you to build up just the right amount of heat for the safest and most efficient procedure possible. Throughout the entire procedure, the Thermoguide temperatures should not exceed 47 degrees Celsius, and the skin surface temperatures should not exceed 38 to 40 degrees Celsius for a safer and more uniform treatment. Use of subdermal Thermoguide at these temperature set points of 45 to 47 degrees Celsius, when combined with the required laser parameters, helps to maintain the correct skin surface temperature. Surface temperature may continue to rise several degrees post-treatment as the heat accumulates subdermally. If temperature rises above specified limits, apply ice or cold compresses on the surgical field to control temperature rise above the desired temperature. Gently squeeze lipids, disrupted adipocytes, and remaining liquid contained in the treatment area from the incision sites. A rolled-up towel or sterilized medical roller may be used to facilitate this process. Be careful not to use excessive force to remove the liquids. Each subject shall be evaluated immediately post-treatment for complications and side effects. Antibacterial cream or ointment may be used for wound sites. Incision sites may be stitched or left open. The patient may experience some draining from these sites after treatment. Antibacterial cleansers such as HibaCleanse, antiseptic antimicrobial cleanser, or betadine solution may be used to clean the treatment area. Standard of care post-op wound care instructions should be provided, and all subjects should wear a compression garment for a period after the surgery as determined by the physician. Using foam inside the compression garments will help decrease the risk of seroma. Cellulaze results are long-lasting, and clinical studies have demonstrated results may persist for a year or more. A special thank you to Dr. Christine Petty and her staff at Aesthetic Accents Cosmetic and Laser Surgery Center for their informative and generous contribution to the production of this video.